This time I would like to invite Ms. Shyla Paul. She's an RN and she's going to explain to you her personal story.
Good afternoon, everyone. My name is Shyla Paul, and by profession, I'm a nurse case manager at Northwell Health System. But I'm not here to talk about cancer or the classifications, the different types of cancer or stages. Dr. Matthew called me 3 days ago, and by the way, he's my PCP, and asked me whether I am willing to share my experience before a group of beautiful people like you. Immediately I said yes, because my daughter Sharon, who is a medical student, she just asked me 2 weeks ago, she told me that, Mom, why don't you consider educating women about the importance of breast cancer screening? And if you can influence at least one person, it will be a great achievement. And I was seriously thinking about it. Every time I visit Dr. Matthew, he advised me to go for a mammogram. And initially, I ignored. But after, he always gives me the script and all. So finally, I decided to have my mammogram 5 years ago. And everything was okay. So those who had the mammogram, you know that, it's not a pleasant experience. The compression really hurts. So I didn't bother to have it for many years after. Like I said, I work for Northwell Health System. It used to be North Shore LIJ. And the system gave great opportunity to its employees, encourage us to have the preventive care like mammo, dental exams, eye exams, annual physicals, etc. So, and we get credit for that. The deadline is actually 31st of October. I waited. I had 3 because you get credit for 4 of them. And I was thinking whether I should have my mammo or not. But finally, I went to have it on the 28th of December 2015. I waited for the last minute, but it's it's better than never. I think generally we nurses, and doctors, we put ourselves last. I had my mammo on the 28th, and the same evening, the radiologist called me, and she said I may have to repeat my mammo because she saw some calcifications. I wasn't worried at all because I knew that the calcifications are very common after a certain age, and usually it's benign. So I repeated my mammo on the 31st of December. So the result was the same. So she asked me to go for a stereotactic core biopsy. I didn't have a slightest doubt in my mind because I do self-breast exam every month, had no classical symptoms such as pain, lump, or discharge, etc. And moreover, I have no family history of breast cancer or any other cancers ever. So I delayed it for a month, but decided to have it on the 27th of January 2016 by Dr. Gupta, who is a radiologist. She took multiple samples and told me it takes few days to get the report. But the next day evening, I received a call from Dr. Gupta, and she said she has bad news for me. I felt like I was struck by a lightning. But somehow I managed to control my emotion and asked her, how big is the tumor? She said, it's a small one, around 0.3 centimeter, and no lymphatic system involvement noted, so which was good. And she advised me to see a breast surgeon. I was so shocked and upset. Didn't know what to do. Cried for so long. Asked God, why me? I was afraid to inform to my husband and children. Didn't know how would they take it. So kept it as a secret for 2 days. And then my husband started asking me, what is the report? Did you get the report? Did the doctor call you? Then finally I had to reveal. I didn't have the courage to tell him in his face, so I videotaped and gave to him. I feel so silly now. I'm so blessed to have a supportive family, my husband, children, my siblings, and a group of good friends gave me the strength to think cancer is not going to conquer me, but I will conquer the cancer. When you have a positive mentality, I think everything falls right. I was able to get an appointment with Dr. Karen Kostrov, who is one of the best surgeons, I think, in United States. She's the best. Within a week, and she scheduled my lumpectomy on 22nd of February. Originally, she planned 2 incisions, one for tumor removal and the other one to remove some lymph node to see if there is any lymph node involvement. But the day of surgery, during the wire localization, Dr. Kostrov said she will try to make 1 incision and try to remove the tumor and the lymph nodes. She removed 4 lymph nodes and through the same incision. Luckily, there is no lymph node involvement. I had a clear margin. Dr. Kostrov presented my case with her team. They do have like a presentation, I think every 3 or 4 weeks, discuss certain cases, because she wasn't sure. She knew that I knew that I'm supposed to go for the radiation, but she didn't know how many treatments I needed. So she discussed the case with Dr. Lee, oncology radiologist, and Dr. Sharma, who is the oncologist, and came up with my treatment plan of 21 radiation out of that 16 plus 5 booster dose, and which was every day, Monday through Friday. I go for my treatment in the morning and then after to work, which was very simple than I expected. And on 22nd of April, I have completed my radiation treatment, and it was a big celebration for my family. My husband and children, they arranged a party for me that day. I'm greatly thankful to Dr. Matthew and Northwell Health System for motivating me to have that mammogram. Because of that, I was able to diagnose at a very early stage. Because of that, I was able to have breast conserving surgery. Because of that, I have no disfiguration. And because of that, I'm standing before you and talk about my success story. We all know that prevention is better than cure. The best way to fight breast cancer is to have a plan that helps you detect the disease in its early stage. Create your early detection plan to receive reminders to do self-breast exam every month, 7 to 10 days of your menstrual period starts, when the breast is least tender and lumpy. And those who are menopaused, select the same day each month. Schedule your clinical breast exam and mammogram based on your age and health history. Just remember, 1 in 8 women are diagnosed with breast cancer during her lifetime. When breast cancer is detected early, the 5-year survival rate is 100%. So I urge all of the women, men too. I did my research. I was sleepless for many nights. Studies shows that men are not exempted. There are more than 2,000, I think, cases already diagnosed in men. Give yourself a breast exam once a month. Look for any changes in breast tissue, such as changes in size, feeling a palpable lump, dimpling or inversion of the nipple, redness, scaly skin, or discharge. If you notice any of these, make an appointment with your primary doctor immediately. And routine mammogram after the age of 40 is very important. It saves life, saved mine. So what is preventing you for not having that mammo? Is it the pain, uncomfortable, fear of radiation exposure? But from my personal experience, I can assure you the benefits of mammogram outweigh the risk from the radiation exposure. Mammo requires very small dose of radiation and the risk is extremely low. So what are you waiting for? thank you all for listening me, and thank you, Dr. Matthew, for giving me this opportunity.
I want Mr. Paul also to come on stage, please. And I think we should all give her a round applause. I think today's the best topic or the best presentation was Shyla Paul's. Thank you very much.
Thank you, Doctor. Thank you.